Hi there and welcome along. My name is Paul Gough. I'm one of the UK's leading physios, and today I'm going to be talking to you about that ankle sprain that seems to be causing your problem. A couple of things we'll talk about today: what an ankle sprain actually is, why is it a problem, not just in terms of the pain but also in terms of the restriction on your life, why it's stopping you doing the things that you want to do, and we'll also look at how physio can help. But before we do that, I'll just give you a brief introduction into who I am. That's me there in my office here in Hartlepool. That's me working with Darlington Football Club. I used to work with Darlington and Middlesbrough here in the North East. And more recently, that's me in America working with Manchester United footballer Paul Scholes at his soccer camp in Florida. So my background leads me to have seen a lot of these ankle sprains. And as you can imagine, working in professional sport, they're a very familiar problem for a physio to tease. So let's talk about the real problem with an ankle sprain. For most people, it's the pain to start with. But what becomes a problem later on, if you're not careful, is this thing called scar tissue. And scar tissue is this thing that your body uses when you damage that ankle. So when you've first gone over on your ankle, or you've twisted, or you fell on the ice, or you've done whatever you've done playing sport, your body is obviously trying to heal itself, and it does this by using this thing called scar tissue. But what it means is that your ankle can end up too stiff or too tight, and you might be going through this right now. You've gone through the initial pain, the swelling settled, 6 months, 6 weeks, 2 months, 3 months, whatever it'll be after the initial injury. You're still in trouble. You're still getting problems with this ankle. It won't let you do what you want to do, and it's often as a result of this thing called scar tissue, which I'll explain and I'll talk you through as we go along. First, let's confirm that you've actually got an ankle sprain. Have a quick look on the picture. You can see I've highlighted the area. That's usually the first reaction of a person who sprains their ankle. More often than not, you know you've done it, and it's usually because of a twist or a fall. So you've been out walking. Let's say you've been walking in Guisborough, you've been out in Durham somewhere, and it's a little bit hilly or a little bit of an uneven surface. You fell. You could have simply slipped on the ice. It could be through sport, badminton, tennis. It could be through football, cricket, basketball, obviously, where you jump and you land. All of these sorts of sports can cause a fall or a twist as you land and sprain this ankle. You're going to have probably sharp pain on the outside. More often than not, it's on the outside of your ankle. And as I say, you're normally aware of it, and it's usually an instinctive or an intuitive reaction that you'll go straight for the outside of your ankle when you've done it. And it's going to hurt when you twist or you turn. What I find often with ankle sprains is that once the initial pain is gone, a person's able to walk in what I call a straight line. So you'll walk in straight lines and it's fine. You can possibly even run in a straight line. But as soon as you need to twist or turn, your ankle is going to give you pain. And that's a great indicator of what is a true ankle sprain. And one big thing, your ankle may look like this when you first did it. And this is not uncommon to have happened in the first 4 or 5 days, to see this much swelling and bruising around the ankle and around your foot. So what is it? It's basically an ankle sprain is a tear in one of the ligaments in your ankle. More often than not, it's on the outside, and don't worry too much whether it's torn or sprained. You may hear people say that they've torn their ankle ligament, they've sprained it, they've damaged it. It kind of all means the same thing. It just means that the fibers that make up that ankle ligament, which often run in that area there, which you can see highlighted in the blue circle, have been damaged because of this twist or this fall that has just happened. And it's often that it stretches not just too far, but it happens too fast, and that your body can't control it. Your ankle you'll go over on the outside of it, and that will cause it to rupture or it'll cause it to tear. Best way to imagine it, think of an elastic band. As you stretch an elastic band, it should have quite a lot of flexibility, and it's the same at an ankle joint. As you turn around a corner, that ankle ligament needs to have enough flexibility to allow your foot to turn. When you pull it too fast, too tight, the band can snap in the same way that your ankle ligament could snap. So the real way to think about it is a band would fray, would snap. Again, an ankle ligament can fray or it can snap, and when it frays, that's the fibers of your ligament that are snapping or tearing. And an instant reaction that your body will do kind of 4 or 5 days in is to put down this scar tissue. Think of that as a glue or cement. You need that cement in there to get that ankle ligament as strong as possible. But unfortunately what happens, and it happens in a lot of people's cases, that might be happening in yours, you've been told to rest it. You rest it for 4 weeks, and there's so much scar tissue in there, there's so much cement that this ankle is now really, really stiff. So one of our jobs as physios is to get that ankle moving as quick as possible, and it is kind of why you need to access the physios as fast as possible to get your hands-on treatment. So why have you got the pain and the restriction? Well, the fibers are torn. If you snap something, it's going to cause you a problem. The swelling is there to keep you immobile, so it's kind of a good thing in the first few days, but I would still advise that you use ice to limit that as much as possible, and give it 4 or 5 days of doing nothing other than ice. And that swelling, you can see it's so much pressure, there's so much fluid in there, it's got nowhere to go other than to force against the bones in your foot, and that can cause the pain as well that you're feeling. And the big problem with the restriction is it heals wrong. This scar tissue sets down, it's so stiff and so tight. It's not that it isn't strong anymore, it's actually too strong. So if that's you and you're listening to this or watching this and you're in that pain and you're 6 weeks down the line, you need to get physio as fast as possible. And likewise, if it's just happened to you, don't make that mistake of being in that position 6 weeks down the line, that this is going to be a problem for you. How can physio help? Well, hands-on treatment is 100% vital. It's a no-brainer. You need to get hands-on treatment. Think of the first thing that you do when you're in pain with an ankle sprain. You probably put your hands on it in an attempt to help it. And that's kind of what we do. We'll do lots of massage, we'll do lots of stretching, and we'll basically get rid of all that fluid and all that pressure that's inside the ankle joint, but we'll also mold that ligament, that scar tissue that's probably getting laid down right now. We'll mold that so that it stays flexible and it stays loose and it isn't going to cause you any problems later on. We'll give you an explanation of your injury. We'll tell you why you're in the pain that you're in. We'll look at exactly specifically why it's happened to you to see if there's any other problems. If you have a problem with your balance, that might lead you to this type of thing happening more often. Could you have a problem with your back? If your back's really stiff, it can affect your ankle. So there's lots of things in play, and we'll talk to you about that as well. And we'll give you some exercises for you to do at home. If you have a quick look in that picture, that is a classic simple exercise that we can give you. Isolates your ankle and stretches that ligament on the outside of your foot perfectly. And we'll also tell you when it's safe to return. This is vital. It's one thing returning to sport or returning to your activity. It's another thing returning safely. And what we mean by safely is that there's less chance, or there's very limited chance of this injury happening to you again if you return too quickly. Very briefly, what you'll get from physio, it's going to take about 3 to 4 weeks to heal. If your ankle look like that, you can expect this to take 3 or 4 weeks from the start of your physio. 3 or 4 sessions. You need lots of deep massage, lots of stretching. Balance exercises are vital, as is strength exercises as well. So we can definitely help you if you've got this ankle sprain. Where are we? Our clinics are in Darlington, they're in Durham, they're in Guisborough, and we're also in Hartlepool. That's a picture there that you're looking at from inside one of our clinics. And one thing that we will always offer you with an ankle sprain and any of the injuries, that if you ever visit our clinic for us, we offer you an ability to get your session free if physio can't help. So if you book your appointment with us and it turns out that physio isn't right for you, you'll not have to pay. It could be anything. It could be that the cartilage is damaged, there could be a bone loose inside your foot, which isn't appropriate or relevant for physio. But we will tell you who the best person is to see. It might be an x-ray, it might be a doctor that you need to see, but we will be able to diagnose that and give you the right information, but we will never charge you for your session, and that's kind of true of any injury that we see. We'll always offer you that. If you call up and you book your appointment and it turns out that we can't help you, we'll not expect you to pay for your treatment. So how do you book? You can give us a call. The telephone number is 0800 043 8671, and that'll get you through to any of our clinics here in the northeast. And we always say, if you want to speak to one of our physios as well, just to confirm that, again, 110% that it is an ankle sprain that we can help with, or you just want some advice and you want a few exercises to begin with and see how that goes, again, that's no problem whatsoever. Just feel free to give us a call to book your session. Last thing to confirm, you will definitely get hands-on treatment from us. You'll get an explanation of what you've done and when it's safe to return, and we'll also probably be able to guide you pretty quickly into some form of activity. It might be swimming, it might be walking, it might be jogging at a less of an intensity or less of a pace than you might hope, but we'll aim to get you back into activity as quickly as possible. We'll give you great exercises to do at home, and like I said, the big thing, the real value for money in a physio is not just hands-on. We'll tell you when it's safe to return, not when it's okay to return, but when it's safe to return, so you know that that's not going to happen again in the future. That's it from me. If you want to give us a call, 0800 043 8671 is our number. You can get through to our clinics in Darlington, Durham, Guisborough and Hartlepool. I hope this has helped. Thanks for watching. Take care, and I'll speak to you soon.